So I want to emphasize again, we are in a great place for considering if you're considering having a pregnancy and you're on anti-seizure medications, because we have gained so much information over the last decade or two that we really actually can help with keeping the seizures stabilized and controlled, but not causing any harm to the developing child, baby. So one of the things that we have found out through our study, maternal outcomes and neurodevelopmental effects of anti-epileptic drugs, also known as the MONEED study, one thing that we help to clarify is really at the very beginning of pregnancy, the medication levels can start decreasing or dropping in your bloodstream. And that's because the body changes right away. So there's a lot more urine output, as you may know if you've been pregnant before, having to go to the bathroom all the time. And the kidneys are trying to clear that medication. And there's also changes in the liver that break down the medication, metabolize it much more quickly. So as soon as the pregnancy starts, we need to start monitoring to see where the medication levels are. So as an example, if you went into pregnancy and your level of a medication was 4.0, we want to keep it at 4.0. And so what we're going to need to do is to increase the dose throughout pregnancy to keep that level where it needs to be to keep your seizures controlled. So as you take more medication, take higher doses of the medication, your brain is still seeing a level of 4.0 and the baby is still only seeing a level of 4.0. So there's not more exposure to the developing baby as the dose is increased. And as an example, some of our more common medications, at the end of pregnancy, the dose will be 2 or 3-fold what it was at the beginning of pregnancy. So if the dose started at 300 milligrams, expect by the end of pregnancy, the dose will be about 900 or 1,000 milligrams. Or if the dose was 1,000 milligrams, it'll be approximately 2,000 or 3,000 milligrams. So just knowing that, and that's the way to keep you safe and actually keep the pregnancy safe as well.